So when performing spirometry for a patient, obviously the first step is to ensure that we enter the correct demographic details for the patient, and the important things are obviously their name, but also their height and weight, because when we look at the values as the normal values, we adjust those based on the patient's age, height and weight. So once they're imported into the system, we then need to make sure that they have not had their regular inhaler therapy prior to the test. The reason for this is that if they take bronchodilators before the test, then if we do a post-bronchodilator spirometry, it will be affected by the inhalers that they may have taken before the test. So ideally, if we're doing spirometry pre and post bronchodilator, then it's important for the patient not to have had their bronchodilators before the test. And the easy way to remember for how long they should be withheld is based on how long they tend to last for. So a short-acting bronchodilator such as salbutamol should be withheld for 3 to 4 hours, whereas a twice-daily bronchodilator such as salmeterol should be withheld for 12 hours, and a once-daily bronchodilator such as indacaterol should be withheld for 24 hours. So when preparing a patient for spirometry, we usually do that in the seated positions, such as what I am in now. It's important to have the patient sitting upright. We have the mouthpiece sitting at the right height so that the patient can comfortably put that within their mouth. We use a peg to close the nose to make sure that all airflow is through the mouth and being measured through the spirometer. And then it's important just to let the patient relax as much as possible, but also to understand that it is actually a difficult test to perform and it does take a bit of effort. And if the patient doesn't feel that it's taken a bit of effort, then they probably haven't tried as hard as they possibly can, and so the results might be less than what they're able to achieve. So the idea is that with the mouthpiece in, they take a big breath in until they can't get any more air into their lung at all, and then forcefully exhale. So they need to exhale as hard and as fast as they possibly can, and it's useful to demonstrate that to them before they do it. And then expiration really tails off, and people usually feel like they can't get any more air out of their chest. And you always hear the respiratory scientists urging patients on and encourage them and saying, come on, more, keep going, because people really do think that they can't get any more air out, but in those last few seconds it's important to measure that real tail off of the expiratory manoeuvre. So encourage patients to breathe out as much as possible, and once they reach that about 6-second mark, then they take a big breath in, back to full lung capacity, and that completes the flow volume loop. So the spirometry manoeuvre is then performed 3 times. And the idea behind doing it 3 times is that we then choose the best value and record that one. It's also useful to determine the repeatability of the test, because we want to make sure that the best 2 values are at least within 100 mils of each other, so then we know that they're representative of the patient's best effort. Doing the test 3 times can also cause patients to sometimes feel a little bit lightheaded or have a little bit of chest pain, so just reassuring them that it is a difficult test to do, and that it's okay that they find it difficult. If they do feel lightheaded or feel chest pain, obviously it's important to stop the test and make sure that the patient is okay.